Thank you for joining the National Crime Victim Bar Association webinar, which is being sponsored by the National Center for Victims of Crime. You can learn more about the Bar Association at victimbar.org. For today's presentation, we are going to be taking questions through the Q&A feature, which is at the bottom of your screen. We're going to leave the chat feature open so you can talk amongst yourselves and continue that conversation in that chat, but any official questions we will take through the Q&A feature. As a reminder, this session is being recorded so that we can place this video on our YouTube page so that it is then available to everyone on our call. Today's topic is It Takes a Village, Protecting the Elderly from Abuse. Our speaker is Ashley Hadler. Ashley's from the law firm of Giero and Germano. Ashley focuses her law practice representing survivors and families affected by nursing home abuse, sexual abuse, and medical malpractice. Ashley's clients range in age from children to the elderly, and she has experience handling sexual abuse and assault cases that happened in churches or in religious organizations, in residential care facilities, at daycares, at schools, and in organized sports. She handles cases throughout Indiana and Illinois. If you have questions for Ashley, go ahead and use that Q&A feature. We will take them if they are timely and urgent. Some of them we might hold until the end, but certainly go ahead and ask them right away. Please join me in welcoming Ashley.
Hi, everyone. Good afternoon. Thanks so much, Renee, for the intro. As Renee said, I am a lawyer and I practice in the Midwest doing nursing home abuse, sexual abuse, and medical malpractice cases. And I wanted to answer a lot of questions today that I've been getting from my clients and family members, members of the public. And I think right now, nursing home abuse is something at the forefront of everyone's mind, and it's something important for us to address. So I understand that in our audience today, we have attorneys and non-attorneys, we have victim advocates, guardians, and so I will do my best to keep everything as general as possible so that I pull in and I'm able to hit everyone's questions. But if I don't go deep enough into a topic and you want to learn more or you have additional questions, my email is here on the slide that's up currently, and I welcome any communication from you about additional questions or resources after we're finished today. So first, we know that in the media there have been a lot of sensational stories about really horrific incidents that are occurring all over the nation dealing with the COVID virus and trying to keep all of the residents in long-term care facilities safe. And long-term care facilities, I'll use that term generally throughout today's presentation, but when I use that term, I'm talking about anywhere where vulnerable people live. So that could be a skilled nursing facility, that could be an assisted living facility, or it may be a residential facility or a community integrated living arrangement, a group home of some type. So the topics that we're talking about will apply to all of them. The specific requirements and regulations may be a little different for each of those types of facilities, and that's something I'll talk more about as we get a little further into today's presentation. So why does abuse occur? This is something that myself and other lawyers who practice in this area have thought a lot about, we've researched a lot into, and it's something we see throughout the cases we handle is that abuse and neglect occur because of bad actors. Sometimes I would say in a lesser circumstance, it may be an individual bad actor. So you may have an individual perpetrator who is taking advantage of an elderly person, either through financial exploitation, potentially sexual abuse, or physical abuse, mental abuse of some kind. Most of the time, what we see in nursing home cases is systemic abuse. So this is a corporation who has made a decision to place their profits over the health and safety of their residents. And when you see a corporation making those decisions, what is happening is that the profit margin that they are working with, they are maximizing toward keeping those profits in the corporation, distributing those to the people who hold the interest, and in doing so, they are underfunding the care that's being provided at the facility. So that can be understaffing, that can be a lack of supplies, it can be a whole host of decisions that are meant to keep the money in the corporation and not spending it as they're supposed to under federal or state regulations to provide care to residents. So that's something to keep in mind. Anytime you are seeing a nursing home case, or you're hearing about a law firm or a lawyer pursuing a case against a nursing home, it doesn't mean that we think that the nurses or the CNAs don't have the residents' best interest at heart. They may very well have the residents' best interest at the top of mind. It may be their goal to protect their residents. They're doing everything they can, but they may not have enough help. They may be assigned more residents than they're able to take care of. They don't have enough resources to do their job. And so those are corporate decisions. We place those with the administration of the nursing home, the board of governors who make those decisions. So what types of injuries do we see occur when these decisions are being made? There are a number of things that you probably know and hear about. Anytime a resident falls, it can lead to a serious injury, a hip fracture, a shoulder dislocation, head trauma of some kind. It may or may not be evident at the time the person falls. Sometimes head injuries take time to show signs and symptoms, so it's important in those cases that if a fall is unwitnessed, the person is presumed to have a head injury until that is ruled out through neurological checks. There are a number of things that should be done to investigate and assess the resident after a fall. Pressure sores or bed sores are something that you hear of a lot in the nursing home context. And pressure sores sometimes may develop even if appropriate care is given. I will say that based on the expert nurses and doctors I have worked with and spoken to and all of the research on this topic, if appropriate care is being given, typically pressure sores or bed sores do not develop. Bed sores develop because of unrelieved pressure. So in order to prevent a pressure sore from occurring, the nursing home has to do a number of things. They have to follow their policy, which is to assess the resident, to take the findings from that assessment and identify risk factors for things like falls and pressure sores. After they've determined what the risks are and how high and how great the risk is, they have to develop a care plan that's meant to address each of those individual risk factors. Once they have done that, the care plan, which is a written document or an electronic document if they use a computer system, it is memorialized there, and then it should be communicated to the people who are actually caring for the resident, so the nurses or the CNAs. So once that is communicated, it is the staff's responsibility to implement that plan. So that means if there is an intervention in place to turn and reposition the resident every 2 hours, that should always be done. Every time that's done, it should be documented in the resident's chart. If those things are not done, then that is considered what we call a violation of the standard of care. It means that the staff is not acting to the appropriate level that they should. They're not acting as a reasonably careful nurse or a reasonably careful CNA in the situation. And once the interventions are implemented, every so often or upon a changing condition, those risk factors should be reassessed And if the resident's condition has changed, it may warrant a change in the care plan that's being used to prevent bed sores or falls.
Hey,
Malnutrition.
Ashley,
Yeah,
we got our first question already that might need to be answered beforehand.
great.
So when looking for an attorney to deal with elder issues, how important is it to find one with a certified elder law attorney, which is a CELA rating? Is this a certification which signifies substantive expertise about elder issues, or is it merely an indication that an attorney has taken a minimal number of continuing education units each year?
That's a great question. So that is a certification that may be great to have. It may mean that the person has taken some additional coursework or continuing legal education in that area. I'll tell you that it can mean that that person just has more information and knowledge in the area of probate law or estates or Medicare or Medicaid or other things affecting elders. I think the most important piece of advice I would give someone if you were looking for an attorney to handle a nursing home abuse case or an injury that occurred in a nursing home, make sure that attorney has handled those types of cases. Ask them about their experience in that area. Ask them about the results that they've been able to obtain for clients, the type of injuries they handled. So in my opinion, if I were looking for an attorney for a family member in another state where I wasn't licensed, I would start looking at how much direct knowledge and experience does the attorney have handling the same type of case that I'm looking at.
And you might be covering this in a few slides. I can't remember, but I think it'd be important to answer throughout. What are best practices to collaborate with nursing homes to help prevent these common causes of neglect, since so many of them feel like you're trying to expose them to legal liabilities rather than work with them?
That's a great question, and that's something we'll cover. We have a section that's focused just on what types of questions to ask and how best to collaborate with the staff, because it is something that is a team effort. It involves the doctor, it involves the nursing home, the direct care staff, and the family or the guardian representative who's working with the resident, and of course the resident personally. So we will cover that. I have just a few sections before it, but absolutely we'll get to that. And the other types of cases here, I think, are self-explanatory as far as the injuries that we see. These are all things that it's important for any family member or guardian to be aware of that could happen and to consider when they are looking at a facility for their loved one or keeping tabs on what's occurring in the facility. Some things that we covered just briefly before: the systemic issues that can lead to the types of injuries that we saw in the last slide. Any staffing issue is always of very high concern. If there are not enough staff to care for the residents, then falls definitely occur. Turning and repositioning to prevent bed sores won't occur. The type of intake and output tracking to determine how much nutrition and hydration is a person getting, those won't be able to occur. And documentation always suffers if there's not enough staff. High turnover is something I hear a lot about from my clients. It's very important for family members to keep tabs on how frequently are people leaving the facility. Some of the direct care providers, CNAs or qualified medical assistants, may turn over because unfortunately they usually are not paid enough. And that's something that, again, is a corporate decision. I know here, I live in Indianapolis, and I heard from someone that they had a hard time getting the direct care staff to stay in working in nursing homes recently because we had an IKEA store open, and the starting wage working at IKEA was more than the starting wage, what was being paid to CNAs. And that is really a disgrace. It makes me sad because this is very, very difficult work. It takes people who care very much about caring for others to do this work, and it's something that should be compensated and be compensated well so that we have people there who have the resources that they need to do those jobs. Some other things, budgeting we talked about quickly. Under qualified staff, perhaps someone has a criminal history, and if you have certain types of felony or misdemeanor convictions, you are not suited to work in a nursing home according to most state laws. And so it's very important that the appropriate level of background checks and references are completed. The appropriate training program is completed. We'll talk a bit about how the federal government has waived some of those requirements right now due to the COVID pandemic that we're facing. Certainly that is a risk-benefit situation to be weighed, because it's important that we have additional people available to staff the facilities right now, because a lot of staff members are getting sick and not able to report to work. But it's also concerning if someone does not have the appropriate background or appropriate training to be performing those tasks. So that's something that as a nation at the federal level, we will have to figure out, and a state-by-state determination to be made as well. Also very important are the policies and procedures that the facility is implementing. I know here in Indiana and in Illinois where I practice, policies and procedures are something that are available to the public. They are available to nursing home residents and to their representatives. So if you have a loved one in a facility, you are entitled to have a copy of their policies and procedures. So that's something that you should ask for. And then if something comes up, if an incident arises or your loved one has a fall, you can look back to those policies and ask more questions to make sure that they followed the policy in investigating that fall and in trying to prevent it in the first place. So that's a great resource, something definitely to be aware of and ask for. So when we're looking for signs of negligence, it's something that if you are in the facility, or right now you can't be in the facility, so your loved one is there, and if you're asking questions, what are the signs? How do you know that understaffing may be occurring? What do you see? What do you hear? What do you smell, feel? Those are all very important things. We've got to use all of the tools available to us to identify these things. So what you're looking for as a family member, look around when you're able to be in the facility, or if you are able right now to do a Zoom video call or a web visit, a window visit where you're going to the facility and interacting with your loved one. Look for how well are the residents kept? Are they well groomed? Do they seem to be up at appropriate times of day? Are they being put to bed too early or too late? Look to see how well it just appears they're being cared for. Take a look, see where the nurses are when you're in the facility. Do you recognize them? Are you seeing the same people at the same times of day? Typically, nursing homes work on 3 shifts, so 7 to 3, 3 to 11, and 11 to 7. So you may see the same first, second, and third shift workers. Weekends, you may see different people there, or you may see people working doubles. So it's important to keep track of that and ask questions about it. If it's something that you haven't seen someone for a while and you're wondering if they're still with the facility, check in on that. And I always recommend to my clients that you make visits at different times of day. Typically, the nursing homes and assisted living facilities have more staff on hand during the day. when the residents are up and moving around and going to and from activities or meals. But in the evening, it's also very important, especially if the home has a memory care component, for enough staff to be present when residents may be having what we call sundowning or additional memory problems in the evening time before bed. It's also very important, of course, that they have appropriate staff there at night in case people are trying to get up unassisted, trying to go to the bathroom, having, you know, any problems overnight that would need to be addressed.
Hey, Ashley.
Mm-hmm.
One question that goes along with this, when a person first enters a nursing home and the family's with them and bringing them to those initial meetings, do you think it's a plus or a minus to have an attorney in attendance at that initial care plan meeting and then at follow-up meetings? Does that direct involvement serve as kind of, is the questioner saying a polite deterrent, or is it intimidating?
That's a really good question. I think it's important to build a rapport and a trust between the facility staff, the director of nursing, the administrator, and the family member. And I agree. I think that may be somewhat off-putting or intimidating. But as I'll talk about later in my slides, one thing that's extremely important is that you don't sign anything that you don't understand unless you've had someone explain that to you. Obviously, my first recommendation, top choice, would be that you have an attorney review any admission paperwork before you sign it. There are things that you should look out for. The word arbitration is something that most people are not familiar with. They don't understand the full implications of it. And it's a very, very serious clause that's contained in a lot of admission contracts that can cause you to waive many, many constitutional rights. So I would say don't sign anything at a minimum unless you have had an attorney take a look at it. I know attorneys in most states who would look at that for free. I would look at an admission agreement free of charge for anyone who contacts me and asks me about that. It is that important to me that people are not being admitted to nursing homes, waiving their rights without having that input from an attorney about what they are entitled to upon an admission to a nursing home. As far as having someone there actually at the care plan meeting, I don't think it's necessary to have an attorney there, but certainly take notes, keep all of those things, communicate with your attorney if there are any questions about the level of care that's being provided. If you are concerned that the facility may not have the appropriate level of staff, type of staff to care for your loved one, then that's something that you would want to talk to an attorney about. The other things here, just taking a look to see kind of how long things are left in the residence room as far as food trays, water pitchers, and taking in and observing how do the staff members seem. Are they super busy? Are they running around? Are they not busy at all? Are they on their phones? Are they chatting with each other? Keeping tabs on those things and just being aware of that and being aware of when it changes is important. These are more of the same. One thing that's important when you are visiting is to keep an eye on call light response times. So if you are in the facility with your loved one, it's always interesting at some point or, you know, at various times to have them use their call light and see how long it takes for someone to come and respond to their inquiry. How long that takes is very telling about how busy the staff is and if the staffing levels are appropriate. And if your loved one, you know, right now you can't get in to visit them, so that's something to ask them about occasionally, or, you know, if there's a time later on when we are able to go back to the facilities, just check in with them and say, how long is it taking for someone to come to you? Because if it's an urgent need, if someone has to get up and go to the bathroom and they can't do that safely on their own, then it's important to know how quickly does someone get there to help them? Because when staff is not responding to call lights, that's a time when a lot of the negative events we see happening will occur. And always pay attention. I've had clients who've come to me and unfortunately they did not fully appreciate maybe something a family member was saying to them because of their mental status. Sometimes if a person has confusion or other cognitive problems that they're dealing with, it may be easy to say, oh, you know, mom's a little confused. She couldn't have meant what she said, or that doesn't quite make sense to me. But keep track of that. Keep track of reports that they're making that seem a little strange or off. One example I'll give is I had a client whose father was reporting that someone was stealing his necklace, and his dad had dementia, so he wasn't quite sure what that meant, and it didn't look into it that far at first. But then the more the reports came, he realized that he used his call light. His call light was actually a pendant that he wore, and his dad was referring to that as his necklace. And there was a particular CNA in the facility who was taking away his call light, taking away his necklace, and leaving him without that so that he couldn't call for help on that shift because he pressed it too many times, and to that CNA, it was annoying, and that was his way to deal with it, which is obviously inappropriate. So keep track of those claims, and just something that you may look into or maybe ask more questions about. And then cleanliness, this is a huge thing. You know, most family members don't do head to toe body inspections every time they visit, nor should they, but it's important to ask your family member, or from time to time look, see, you know, are you being kept clean and dry? How do your feet look? How does your backside look? Just to make sure that there's nothing going on there that the staff perhaps hasn't found yet or hasn't notified you about. Because those are things that if left unattended, they can quickly deteriorate into serious skin wounds, conditions, or pressure sores. So those things are important. Sometimes when you're visiting, if you are able to and you have the time and you can stay for an extended period of time, if you're spending 4 hours there, if your loved one is at risk for pressure sores in that 4-hour span, they should be turned and repositioned at least twice. So if you're there for a long period of time, keep track of, did someone actually come in and turn and reposition them? Are they using pillows or bolsters or anything to keep your loved one in a position to offload certain areas of their skin? Look through nightstands and drawers. Are there pills that it appears have been left that your family member hasn't taken? Are there any changes that you can tell with their cognitive status or the way they're speaking that would lead you to believe maybe they're not getting their medication, or they're getting a medication that you don't know about that has changed the way that they're interacting with you? So those are things to think about as well.
Hey, Ashley, before we move on to the lawyer's perspective, one good question that came through, how do you do all of those things with the current restrictions? You know, how do you do this? How can you do the smell check? How can you ask those things? And what's the best way to advocate for family members right now?
Yeah, absolutely. That's actually, it's reading my mind. It's coming up. I think it's the section right after.
Perfect. Sorry.
No, it's really important right now. And then for the lawyers who have joined us, we know that in the medical records, a big thing to look for false charting. You can see it pretty easily in electronic records right now if you see something that's backdated or has been changed later. Always important to get an audit trail so that you can see when that data was changed. Missed treatments is something huge. Always important to look at the treatment administration record and see if someone has been turned and repositioned at the appropriate intervals, and check and see, are the dressing changes being done, are skin checks being done? And the rule in nursing is if it's not documented, it's not done. So important to know. Also take a look and see if things are being charted when the resident has already been out of the hospital or out of the facility and onto the hospital. If there's charting in there that extends hours or days past when they're discharged, that's a good sign that it should call into question more of the documentation in the chart. These are more technical topics, things that are resources that are great resources for lawyers to use when investigating these cases. They're also very good for family members to know about. And I include links to these at the end of the presentation on the resource slide. But Medicare Consumer Reports, that is an amazing tool. Medicare has a star rating system, 5 stars being the best, 1 star being the worst. And they rate each facility that receives Medicare and Medicaid and place a star rating for each of them, and they put it on the website so that you can compare the nursing home options for your loved one and determine what's the best fit for them. ISDH is Indiana State Department of Health, but each state has its own Department of Health, and each of those, if you go to their website, they will have a lot of information about the ownership of the facility, funding of the facility, what type of beds do they have, Medicare, Medicaid, private pay, director of nursing and administrator information. That's a really good resource. And then every facility who receives Medicare or Medicaid has a duty to report their financial information, the money that they're bringing in, and how they're spending that money. So that is a great tool. All of that is publicly available information. So I encourage everyone to dig around, play around now while we're at home and have time on Nursing Home Compare and your State Department of Health website. So all facilities who receive Medicare and Medicaid are regulated to some extent by the federal government and by state government. So those regulations are codified. It's called the OBRA regulations, OBRA, and those are a set of regulations that apply to anyone who receives federal funding. And those requirements are very basic, and they are residents' rights, the right to be free from abuse and neglect, and it goes into very detailed requirements for staffing and for types of care that have to be provided. So those are things that typically appear in the admission agreement, but it's important for everyone to be familiar with what the facility is required to provide. And those are bare minimum requirements. Those are things that must be done for the facility to continue operating. Who is paying for the care in the nursing home can tell you a lot about that particular facility. So the options are Medicare, Medicaid, or private payment. And we see differences in the care that's provided based on what kind of payment they're receiving. We know historically that homes that receive Medicare provide more care per resident per day. So this is the way that the homes report their data to the government. They report how much staff they have per resident per day. And so that tells you how much time an individual in a nursing home has with direct one-on-one staff providing care to them. So these are just some statistics about kind of how that breakdown works. Typically, homes that have more Medicaid residents have lower ratings in the staffing and quality of care levels, which is sad and something that needs to be addressed. There are some initiatives to address that. CMS provides supplemental payments to homes in certain states who accept Medicaid residents. So it's something at a federal level that they have tried to address. The problem we're seeing is that even the homes who take more Medicaid residents and have that incentive and are receiving supplemental income from the government are not putting those dollars back into the home to give the residents the benefit. They're still absorbing that into the corporation and not providing it to the residents who are really the people entitled to that. And similarly, it's not just staffing, it's also supplies. So supplies like Hoyer lifts, wheelchairs, specialty beds, air mattresses, oxygen tanks, wound care devices like Roho cushions or bolsters for turning and repositioning, boots or heel protectors. If the homes are not providing those and not using that money to provide those, then that's a problem, and that's something as a family member to be aware of. Be aware if that equipment is available, and if it's not available, ask questions about it and how the facility may be able to work with you to get it in your particular circumstance. Rehospitalization rates are also important. That's data that is also tracked, and it can tell you a lot about the type of care that's being provided, the types of conditions that residents in the home are suffering. So historically, that's something that you can look back on to find out what type of care has been provided there, and that's something you can use when you're determining whether or not to place your loved one in a particular facility. Just some more statistics there. Okay, so this is getting into something it seems like we have some questions about. So right now, with the current pandemic, there have been a number of regulations and requirements that have been loosened or waived entirely. So we're referring to this as the perfect storm, because while the homes are addressing this pandemic, a lot of the measures that the government put in place to hold them accountable have been lifted. So we know we can't have family in the facility right now. There are no visitors. We can't have surveyors from the State Department of Health unless they are there to investigate an immediate jeopardy. So that phrase is really important, the immediate jeopardy. If you make a complaint right now to your State Department of Health through the system that they have in place to report concerns or complaints about these facilities, unless it is an immediate jeopardy to the health and safety of your loved one or other residents, they cannot go in and investigate. So if you are making that report and you are concerned that there is an immediate concern, I'd encourage you to make that clear so that they don't put that off and put off that investigation until a later time. So that's something, you know, you'll have to use your judgment on if you believe it's immediate. And the surveyor, of course, will use their judgment as well in determining if they need to go out and investigate. Also, a lot of the reporting duties for the number of staff that are working in the facility have been waived. So we don't know right now what the staffing levels are in the facilities. That's something that we won't know for some time, and it's important to know. It's important data for the government to have when they're looking at whether these facilities are operating appropriately in a way that they have determined will protect their residents. So that is all on hold right now, as well as a lot of waivers related to the staff certifications and the training. So like we talked about a little earlier, because the staff members are sick and they're having trouble getting enough staff into the facility, they have waived some of the requirements so that people who may not have certified or qualified or been trained to the level that's normally required, if they're willing to come in and do it, right now the training and the certifications, the bar has been lowered so that more people can come in and do that. So these are all things to be aware of when you're thinking about your loved one and what's happening in their home right now. Something we'll hear a lot about in the coming days and weeks is a request for blanket immunity. So right now, there are some competing bills happening for nursing homes, long-term care facilities, other providers out there who have requested that they not be held responsible legally for any response to the COVID pandemic, or potentially for other injuries or things that may occur in the home during this time while the national emergency has been declared and in place. So that's concerning on a number of levels, because accountability is one way that we are able to ensure quality of care for people now and moving forward. So if we talked about the perfect storm of all of these regulations being lifted or waived or changed somewhat right now. So if we don't have those in place and bad things occur, we don't want to incentivize someone to let their guard down. We want to make sure facilities are still operating at the highest possible level and to the standard of care, and still be held accountable if they act in a way that's not. That's something that's important to protect people. CMS right now has given some additional funding to nursing homes across the country, and these are things that are great to be aware of as a family member. They have provided funding that is meant to be used for technology. So you have the opportunity in facilities now for them to go and purchase additional iPads or tablets, protective covers for those things, headphones, and it's meant to allow the residents to use those to communicate with their family members, keep in touch with them. You know, that's incredibly important to their health and well-being. It's also meant to use the device for telehealth. So if their physician is not able to come into the facility and provide the care that they typically would, typically physicians are required to see each resident in person at least one time monthly. And that also is lifted currently. They don't have to actually physically go into the building. So there may not be a doctor in the building. So it's important that the doctor be able to communicate with the patient, see the resident through telehealth. So you can see the allowance there, the maximum amount of $3,000 per facility, or one device for every 7 to 10 residents. There is also an allowance to provide personal protective equipment, or PPE, for 14 days. As we know, that is something that is needed now, and unfortunately, it does not have to be delivered until July under the current regulation. And while a 14-day supply is great, it may not be enough. So that's something that the states and at the federal level should continue to address, because it's so important to protect the workers, the frontline healthcare workers, nurses, CNAs, who are putting their own health and safety at risk and going to work every day to care for people. So that's something that the facility administration, the federal government, and the state government will hopefully continue to work on and make sure to protect those people. This is a breakdown of how the 100 million grant from CMS is meant to be used. And they are providing additional funding to state survey offices. So those are the individual states' Department of Health. And they are giving this additional money so that they can get out there, investigate those immediate jeopardy complaints, complete infection control surveys. Infection control is something that the state surveyors always look at. It's especially important in this time to make sure that they are using the PPE appropriately, doing proper hand washing, quarantining COVID positive patients appropriately in the facilities to prevent that from spreading. It also is meant to provide additional PPE for the surveyors. So when the surveyors are going in, they're able to protect themselves while they're in there providing that incredibly important function of investigating and eventually doing surveys to make sure it's safe for facilities to reopen to visitors. There's a bill pending right now that would add additional safety measures. It's something that provides a lot of great resources. It would provide a full-time infection preventionist to each facility, and that would allow them to make sure their infection policies and procedures, infection control policies are being implemented. It could help them tweak those. It could help them find out about the number of cases they have in the facility and how to keep it from spreading. It would also implement fines for failure to comply with regulations, which is important, again, for accountability. And it would ensure that residents have a right to return to their facility. I know I've heard from a lot of clients right now, if someone has been out of the facility or they've had a hospital stay, they have not been allowed to come back. And that's something that typically there's a hold on a resident's bed for a certain amount of days. And right now those regulations, again, have been waived. And so residents may not have the right to return to their home. Finally, the bill would prohibit transfer without notification. So something concerning we've seen happening is that one of the regulations that is waived under the current pandemic is that people have been discharged from the facility or moved to another facility without warning. And normally there is a process that must be followed for notifying a resident and their representative about an anticipated discharge or required discharge. And that's a collaborative process that gives the family member time to work with other facilities and find the best place to keep their loved one safe. And right now, if the transfer is related to COVID response, people are being transferred sometimes with less than 24 hours warning. So this would require notification to a family member or at the very least to an ombudsman that would receive that notification and be able to work with the family to make sure everyone is in the loop on what's happening. The bill also sets requirements for testing, which are really important. That's something that we all would like to know more about, are the numbers of positive cases. It would require daily testing for staff members, which would be a big help because those are the people coming and going. Sometimes staff members work in multiple facilities, so it would help prevent spread caused by that. Okay, so how do you protect your loved one right now at a distance? Do as much as you can that you were doing before, be creative, do it in a different way if necessary. We talked about the technology grants, ask about those. If you or your loved one don't have the means to have the personal tablet or iPad, ask the facility about whether they've used any of the funds to purchase those so that residents can share those and you can do some kind of a Zoom visit or a FaceTime. If not, you can always send to the facility, to the social services director, a little video. If you have access to a smartphone where you can take a little video using Marco Polo or the video app on your device to send to them so that they can see you and hear you. And that's something that can really mean a lot and can help you stay connected. Be aware that facilities can accept Amazon packages just like anyone else. So I'm a guardian for a vulnerable adult here in Indianapolis, and I have continued to send things that I would normally be delivering personally, you know, just little things to brighten her day and make her feel as normal as possible through this time, which is the same thing that, you know, we're trying to do for ourselves right now.
Hey, Ashley, regarding accountability, if somebody has a client who's in a facility who doesn't have a cell phone and this person's being told that the facility doesn't have a portable phone, what do you suggest doing?
So most residents should have, or most nursing homes should have a phone available at each nurse's station or in the resident's room. So if the facility is telling you that they have no way to take a phone to this person's bedside, I would recommend reaching out to your local ombudsman. So each county should have an ombudsman that works as a liaison between the State Department of Health, the facilities, and family members. But there should be a way that they could deliver or install at least a cordless landline phone so that residents can speak to their loved ones. I mean, that's a very basic requirement, that you be able to communicate directly with your loved one and not just communicate through the staff member. You need to hear their voice, you need to see them, and make sure they're okay during this time. So I would give a call to the local ombudsman first and go from there.
And then there's a follow-up question. Ombudsmen can be really good advocates, but they have such a massive caseload. How can an elder without family members locate an advocate who can be hired to serve as a long-term watchdog,
Sure.
so to speak?
So I would check through any local attorney resources. So if there is someone who's an elder law attorney or an elder abuse attorney, negligence attorney, speak to them. Also look for any programs in your state where volunteer advocates will work with family members. I know here in Indianapolis, we have the Center for At-Risk Elders, and they're an organization that allows people to volunteer as guardians. And so that's a program I've been very involved with, and that's how I'm able to be a guardian for several people in nursing homes here. So check into your local organizations, and even though ombudsmen do have a large caseload, typically they can be responsive in at least getting you resources. So if you needed a private caregiver or a guardian to assist someone, they should be able to point you in the right direction of someone who can spend more one-on-one time with you in that way. I would recommend, following up on the requirements that we've talked about and asking questions about those, and asking questions about how the facility is using the grants that we've talked about for technology and PPE, and make sure that you are documenting everything. Keep good notes, communicate with staff members, communicate with other family members of other residents in the facility. If you're in a community where you know of someone else, take photos or videos, save the information that facilities are sending to you. I know a lot of facilities right now are following their state requirements to send out text messages or group emails notifying people of how many positive COVID cases there are in the facility. Make sure you save those, because all of that can help you to create a record later to give to an ombudsman, give to an attorney, or give to a state surveyor. So make sure you're keeping all of that documentation. And we're approaching the end of our hour here, so a lot of this we'll make the PowerPoint available to you. This slide kind of talks about remedies that are available, whether it's a civil lawsuit or a license suspension that comes from the State Department of Health or from CMS. So those are all options that are available. And then one thing I want to make sure I hit again here is our the arbitration discussion. So arbitration is it's something that a lot of facilities incorporate into their admission agreement, and it will waive the resident's right to have a jury trial. So if they're injured in any manner in the facility, you could not file a lawsuit against them. They may require that any proceeding be confidential, meaning you can't talk about it, you can't tell anyone about it, and it leaves people at risk. It can cause you to waive a lot of rights that you may not understand or know you're waiving. And this is something the federal government has addressed starting September of last year, 2019. They implemented additional requirements. And one of those requirements is that no resident can be forced to sign an arbitration agreement in order to be admitted to a facility. So that's very important to note. You or your representative do not have to sign an arbitration agreement to receive care. So please make sure that if you take away anything from this presentation, and I hope you do, and I appreciate very much your time today, please make sure you do not sign an admission agreement without understanding it. Ask questions, ask an attorney, email me. I will help you find an attorney in your state and have someone look at that. It's something, like I said, lawyers will do for free because we feel so passionately about protecting people from waiving their right to a jury trial, waiving other things they may be entitled to. So please do that. There's a lot of other information here in the PowerPoint and a resources slide here at the end that will take you to the Nursing Home Compare website so you can see the star ratings and some other just great information. A lot of these sites are keeping up on all of the changes that are changing daily with the new COVID regulations. So check those out. Thanks so much for your time, and let me know if you have any questions.
Thank you, Ashley. We have about 11 questions that are open. I can ask them. If folks want to stay on the line, we can take an extra 15 minutes and try to ask these, but otherwise you see Ashley's email on here, so please contact her. For those of you who have to leave, our next webinar will be focused on how civil legal action can be used to assist victims of domestic violence right now. It'll be at the same time, so noon Eastern on June 9th, and updates are always posted on our website at Victim Bar. Again, you see Ashley's email if you have further questions. So for those of you who had questions that are sticking around, is it reasonable to record meetings with staff at admissions, or do you think that would be intimidating as well?
So my first concern, more so than being intimidating, is that it may not be legal in your state if you're not planning to tell the other person that they're being recorded. So each state is different on whether both parties need to be aware of that recording. in any event, I don't think it's necessary to have that recording. I think that so long as you don't sign anything that you don't understand or haven't received legal advice about, and as long as you take good notes, I don't think it's necessary to have a voice recording.
And along the lines of states, there's a question, are you restricted to serve clients only in Indiana and Illinois, or are you available to Texas residents who move to retain you?
I will tell you, I am not licensed in the state of Texas, but through the National Crime Victim Bar Association, we have a wide network of attorneys who practice there. So if you reach out to either me or to the Bar Association, we can point you in the right direction and make sure you're in good hands there in Texas.
And just a reminder, our information is at victimbar.org. There is a client who has not been able to move out of a rehab facility and into an assisted living facility because of lack of hospital beds due to COVID-19. Do you have any suggestions for that?
So to make sure I understand, they would be moving down in care. So if they are at a higher level of care and looking to move to a lower level of care, it will depend first on what state you're in and whether there are any particular restrictions about that discharge process. If you were moving the other way, if you're moving to a higher level of care, meaning they need more care at that point, then that's something that I would reach out to an ombudsman or the Department of Health right away, because if they need a higher level of care, they need to be getting it. And so I would reach out to them to find out how to get that transfer taken care of as soon as possible.
Okay, and Victor asked if a facility is presenting a contract where they're saying if you don't sign, you don't get in. Is that okay? They're really being coerced to sign an arbitration agreement.
So if it is a private facility, then the CMS requirement doesn't apply. If the facility receives Medicare or Medicaid, it is a condition for them receiving that money that they cannot do that. You cannot be forced to sign an arbitration agreement in order to receive care. So I would take the agreement, I would reach out to an attorney in your state and tell them about the requirement if they don't know about the CMS requirement, and have them communicate with the facility for you in that case.
How do you recommend confirming that appropriate background checks have been done at a facility?
That's something that the state will look into. So if you go to your state Department of Health website, there are reports usually about each facility, and you can look back historically at their annual surveys. And as part of the annual survey, they look into whether staff has been appropriately screened and appropriately trained and receiving their continuing education. And if the staff has not been, they'll be cited for that. So it's a great tool. You can go to their website usually and look at all of the surveys, see what their scores have been, see what they've been cited for. Have they had problems with that in the past? And that will tell you at least historically what's happened. Unfortunately, there isn't a great way for a family member to look into that. Obviously, we have to protect the privacy of staff members too, so you're not going to get access to their personnel files. But if you have a concern about any particular person working in the facility, you can always reach out to the State Department of Health, and the Department of Health can look at that particular individual's licensing and certification to make sure that there are no red flags there.
And what if a family does not speak English? Are nursing homes required to get an interpreter to explain an admission application?
That is such a great question. Yes, nursing homes are required to explain the admission paperwork, specifically the arbitration agreement, in a language that the resident and their personal representative understands. So you have a right to have that explained to you in your own language, whether that's verbally or in writing. So you should not be presented with paperwork that you do not understand because of a communication barrier. You are not required to sign that. They are required to explain that to you. It's a great question.
Okay. There is one more very long question. There are a couple we're just not going to get to because of time. But again, Ashley is happy to answer those questions. If you send them to us or to her directly, we'll make sure they get to her. The last one, write-in clauses are allowed in nursing home contracts, but if an admissions contract doesn't address the specific elements of care that a resident will receive, can a facility administrator refuse such care after an admission because that issue or that level of care was not specified in the contract? In other words, how detailed do you need each contract to be to make sure all of your bases are covered?
So this question sounds pretty specific to the type of facility. So it's a little difficult for me to answer not knowing if the facility is skilled or assisted living or residential. Each admission contract will not necessarily provide each element of care that will be provided in writing. That's something I would need to know more about, and an attorney helping you with that would need to know more about what care specifically you're inquiring about, and if that facility is the type that's required to provide it. And then from there, if they're in the right level of care, then there's a requirement that each person be provided with that individual risk assessment and providing each of the interventions that they need to keep them safe and healthy. So it's something, depending on the level of care of the facility that you're talking about here, there's probably a regulation that would require the care be provided once they're there, but it may not appear in the admission agreement. I would ask a local attorney about that specific issue and have them look at the contract for you.
Fantastic. Well, Ashley, thank you for giving us an extra 10 minutes, and thanks everyone for calling in. Again, we're at victimbar.org where you could get all of our contact information, and Ashley's made herself available to you as well. So thanks everyone for calling in today.
Great. Thanks, Renee. Thanks, everyone.